everyone, I'm Dr.Garima Asati. Welcome you all in this YouTube channel. As we all know, the third wave is coming and it spreads faster than any other epidemic or diseases nowadays. So many of you get panicked because of it. So here I come with the details of this COVID third wave. I'm going to describe you about the classification of the symptoms of this COVID third wave in the babies, as well as its diagnostic part, as well as its homeopathic approach. So let's understand first the classification of the symptoms which can be seen in the babies who are suffering from this COVID third wave. Now, the symptoms are classified into three categories in COVID third wave, and these are mild, moderate, and severe. So in mild variety, upper respiratory tract gets infected and it represents as fever, sore throat, cold, cough. So that is the thing which gets affected in mild. It also includes sometimes stomach ache or nausea or vomiting or diarrhea. So these are the mild symptoms. But here the oxygen saturation level is more than 94 and there is no rapid or fast breathing seen in the babies. So this is the mild variety. Here there is no need to hospitalize the baby. It can be treated at the home only. In moderate variety, all the symptoms of the mild variety are present along with the symptoms of pneumonia. That is, there is rapid or fast breathing rate. It varies from age to age. If the baby is of 2 months old, his or her respiratory rate is 60 beats per minute. In between 2 months to 1 year, the respiratory rate becomes 50 beats per minute. In between 1 to 5 years of age, respiratory rate becomes 40 beats per minute. And above 5 years till adult, the respiratory rate becomes 30 beats per minute. In moderate variety, the oxygen saturation level varies between 90 to 94. And there is no danger signs present in this moderate variety. In babies, this respiratory rate counting is more reliable than pulse oximeter reading because it is too difficult to measure via pulse oximeter because baby may be incooperative or while during sleeping the oxygen saturation is already low in anyone. So it becomes too difficult to measure via pulse oximeter. So this breathing rate counting is more reliable in babies. Next question arises is when to calculate this respiratory rate. So when the baby is calm and quiet or while during sleeping. Never take when the baby is irritated, frustrated, crying or feeding milk or eating food. So never take during that time. Babies usually breathe through abdomen. So that is called as abdominal breathing. Now how to calculate or how to measure? When the baby is sleeping, just overlift his clothes and put the hand on the abdomen. And it uplifts our hand while he's breathing. So the number of times our hand moves up and down, that is his respiratory count. So that is because he is doing abdominal breathing. So it's easy to take his respiratory rate. Now count it for 1 minute properly. Don't do this, that count it for 30 seconds and multiply by 2 as because baby's respiration is periodical or irregular. So always do counting for 1 minute properly. And the last one is severe variety. So here there is rapid and fast breathing present along with systemic involvement, and here oxygen saturation level is less than 90. Now what are the systemic involvement or danger signs? So breathing becomes too fast along with abnormal sounds and you can hear it, those sounds. So there is abnormal breathing. This hands, legs, face, lips, ears all may get blue. That is called as cyanosis. Kidney may get affected and urine output may become less or absent. Feeding becomes abnormal. That is, baby is unable to feed, he is not taking food, or appetite may get decreased or absent. There may be convulsions present, that is the involvement of the brain. So if brain or meninges get involved, baby may lead to convulsion because of this COVID third wave severity. Baby may unable to speak a whole sentence. He gets tired and stop talking. He is gasping for air. There is air hunger present. And the symptoms of jaundice may also be seen if there is liver involvement. Now what to do? So take very well precautions of all the COVID-19 rules and regulations. Take care of it. Wear mask, make social distancing, follow it, and kindly take care of your children whether they are getting infected with any kind of viral or cold flu, so that you can be able to manage or deal with this third wave too. Please don't take any risk by sending your child out without any reason. So do take care of yourself. It is the only way to prevent your children from this COVID third wave. Now, what is the diagnostic criteria? So RT-PCR test is more than sufficient for mild cases. If it comes positive, then it means the baby is COVID positive. In moderate or severe cases, we require that CRP, D-dimer, LDH, ferritin, blood test, radiological, ultrasound and HRCT. But it is not required in mild cases. Now let's see some of the homeopathic medicines which can be helpful for managing such cases. So the first medicine is aconite. So if a baby suffers from sudden or violent fever, cold, cough, and there is too much perspiration, face becomes red and hot alternately with the pale cheeks, and there is ailment from fright, fear, sudden shock. So this aconite can be administered within 24 hours and it can be helpful in such cases. Next medicine is Arsenicum album. So it is a very good remedy for allergic rhinitis too. There is severe cold, cough, violent sneezing due to a storm or any kind of dust or any exposure to cold air, along with desire for warm water, that too in sips. So this arsenic can be helpful in such cases. The next medicine is pulsatilla. So there is changeable symptoms in it. Sometimes patient get fever and other time he may suffer from cold or cough. Then next time he is having a stomach ache. Then next time it may be vomiting or diarrhea. Along with desire for open air and can't bear closed room, closed doors. Then pulsatilla can be helpful. And the last medicine is Nux vomica. If child gets irritated, frustrated, fuzzy along with fever, he is an obstinate constitution, gets easily irritated and angry, and there is aorta present, means a question asked again and again makes him angry, with diarrhea alternates with constipation, this Nux vomica can be helpful in such cases. That's all for today. Hope you understand well about it. If there is any query, just feel free to ask in the comment box. We will try to answer all your questions and queries there. If you like the video, just subscribe the channel, tap the bell icon to get the latest updates of the videos, like and share this video. And stay connected to get more informations regarding this topic and some more knowledgeable topics. So stay connected to stay healthy. Thank you.